so exciting. Everyone, thank you for joining this live on AB 1400, also known as CalCare. This is a bill to achieve universal single-payer healthcare in California. This would be a first for the United States as a whole. Today, we will be speaking with Assembly Member Ash Kalra, who is the author of this incredible bill. He, on top of this, he is the chair of the Progressive Caucus in California Labor Committee and first Indian American legislator in California history. He's been fighting for progressive people first policies for his entire career, and I'm thrilled that he's here to talk to us all and answer some burning questions about this incredible bill and CalCare. So let's get started, everybody. First of all, do you want to just explain what is AB 1400 and what it would accomplish?
Yeah, absolutely. So AB 1400 is the California Guaranteed Health Care Act, which is also called CalCare, and it would guarantee health care to every resident of California with no premiums, no copays, no deductibles, and the way we're able, and also it'll be comprehensive care, dental, vision, long-term care. And when people say, well, how can you possibly do that? Well, we already have the most expensive healthcare system in the world. And unfortunately, so much of the money goes to insurance companies, to profit, to administrative waste and administrative costs. You strip those things away and you just have the money go to patient care, you can actually save tens of billions of dollars a year. And so, the reality is that we're the only wealthy country in the nation, in the world, that does not have a guaranteed health care to everyone. We have the worst outcomes of any industrialized and nation in the world, any wealthy nation in the world, in terms of health outcomes. We actually spend more money, public money, for healthcare than any country in the world, and yet we have horrible outcomes where millions don't have healthcare, where you have so many that are literally dying. The number one reason why American families go bankrupt is medical bills. Number one. Most countries, it doesn't even exist. And so the reality is that we're being fleeced, we're being robbed by a for-profit system that does not provide us with comprehensive care. And so we have to change that.
Well, awesome. Exactly. And so how exactly would the implementation of a single-payer healthcare system play out? And I guess some people are confused of even what single-payer healthcare means. Yeah. So if you elaborate on that.
So single-payer healthcare is, right now we have a multi-payer system. What that means is we have over 100 different companies, insurance companies, that pay for healthcare in different forms. As you can imagine, that's incredibly expensive, incredibly complicated. It costs a lot of money. It creates a lot of fraud, a lot of waste. You get rid of all that and have one payer being the government, and the service provider, the government. It's not a government takeover of healthcare. The same private and public healthcare providers would still give the healthcare. You can still have the same doctor, the same hospital, the same clinic. The only difference is, instead of having a convoluted way of paying for that service, you just have one simple payment. It's just like right now with the VA, with Medicare. If you have Medicare and go to the doctor, Medicare just pays for it. Medicare doesn't take over your health care. Medicare doesn't walk into your private doctor's office and say, you know what, we're going to get rid of them, and we have some government employee that's going to be your doctor now. And so we can't believe the hype. I mean, the reality is that the corporations that are benefiting and profiting off our current system want us to believe we're going to lose something, want us to believe we're going to lose choice, when in actuality, we don't really have much choice right now. We have to go within a network. Insurance companies can tell our doctor, can override our doctor in terms of what we need for our health care. And it's absolutely insane. No other country does that. The other countries look at our system as being ridiculous, because it is, and we're all paying for it. Again, we pay for the most expensive healthcare in the world, and yet we have really poor outcomes.
Thank you. And on the point of cost, how will this control healthcare costs? And on top of that, how will it lower or help lower the cost of prescription drugs, which is definitely a problem that we face in this country?
Yeah, so it keeps healthcare costs down in a number of ways. First of all, by getting rid of the administrative waste. 20% of our healthcare costs are administrative costs. which is insane. Any organization, any system that has 20% administrative costs is broken. We would reduce that to low single digits, which is what Medicare is. It is what the VA is. If you don't have to worry about, okay, what kind of insurance do you have? What kind of payment do you have? You just walk in and give your CalCare card. My dad's on Medicare. He just walks in and hands his Medicare card. That reduced a lot of costs in itself. That's one way. We get rid of the profit taking of the insurance company. Think about it. What is the purpose of an insurance company other than to take money out of a system for their own profit? And then they dictate what kind of care you're going to get. It makes very little sense. And so we have the ability to remove that profit taking, remove the fraud and the waste. When you have 100 different payers, that allows for fraud and waste. If you look at any academic study of single payer healthcare, including those done on California, they say it will save at least 10%. When you think about 10%, okay, 10%, that's over $40 billion. We're talking of savings just in California alone. So we then use that money as well as efficiencies to provide greater healthcare. With pharmaceuticals, we can bargain on behalf of 40 million people with drug companies. Right now, they dictate costs that are enormous. By being able to bargain with the weight and the strength of 40 million people, we can lower those costs. And I see comments. Insurance has told me I don't need a medication that was prescribed. Well, they don't want to have to pay for it, or if it's one that they can profit off of, I'm sure they would be happy to give it, right? And so, but at the end of the day, insurance companies are there to make profit for themselves. They're not there to dictate the best care for you. It does include dental care. It includes vision, hearing, and critically, it includes long-term care. Now, a lot of you that are watching may be younger and not understand how significant that is, but grandparents, parents that get older, it's such a huge cost that we don't provide long-term care. And so look, at the end of the day, it's going to be a huge fight, but we need to understand that I'm doing this for the future generation, so that you won't have to be fighting this 10 years from now, 20 years from now,
Definitely. And so just to clarify, no premiums, no deductibles, no out-of-pocket costs to access CalCare benefits. And you're increasing the benefits that you would have received if you were getting healthcare from your employer.
That's right.
That's incredible. So everyone's thinking the same question, I think, at this point, which is, how will my taxes get affected knowing that this whole, we're getting a state consolidation of healthcare?
That's right.
Can you speak on how this is going to be paid for?
And that's a really good way of putting it. We're consolidating the payment system because right now we have a very convoluted, expensive payment system. So when I talk about the taxes, so first of all, important to understand, we pay the highest health tax in the world. It may not be called a tax. It may be called premiums, deductibles, copays. It may be out of network. It may be called denial of health care and denial of treatment. But we actually, in actual real money, pay more than anyone else in the world, more than double. The average employer pays $20,000 for premiums for their worker for their family health care, $6,000 for a single individual. And so what we want to do is get rid of that. We want to detach healthcare from employment. It doesn't make sense. No other country does it like that. It's really mind-boggling, because during a pandemic, what happened? Millions of people lost their health care. It makes, which is the worst time for folks to lose their health care. Exactly. So we would instead get rid of all the premiums and copays. And keep in mind that over 70% of our healthcare is already paid for with our money, federal and state dollars. So we would take all that and put it into one bucket of CalCare. We would add to that bucket a progressive taxation system. And let me get more specific on that.
Please.
1.25% payroll tax for companies that are more than 50 people. So if you have less than 50 people, you pay nothing. If you have more than 50 people, 1.25%. Some might say, whoa, that's a payroll tax on businesses. Let's keep in mind, right now, businesses pay on average, 9.9% of their payroll for their employees' health care.
Wow.
And then you have some, and those are for those that actually pay for healthcare. Exactly. Companies like Walmart don't, because they hire people for 20 hours a week. That's why people work 3-4 jobs. It's because none of the companies want to hire full time, because then they have to pay for healthcare. So what would happen is, it would require companies to pay in a payroll tax. It also would require a 1% payroll tax for employees for if you're making over $50,000 a year. Now, some may say, wait a second, so you're telling me someone making $60,000 a year is now going to have to pay a tax? Well, let me tell you right now, the average employee makes between 50 and 100,000 a year pays 2.7% of their payroll for healthcare. 2.7%. And that's their entire salary. We have what's called a marginal rate. Let me explain a marginal rate to folks. So basically, 1% of over $50,000. So if you make, for example, $55,000 a year, and you're paying 2.7% of your payroll for healthcare, what that means is you're essentially paying, $1,200, $1,400 up, for your healthcare, because that's from $0 to 55,000. Now, what this would mean with 1% marginal rate, it simply means you'll pay 1% on the money you make from $50,000 to $55,000. What that means is on $5,000, you're paying 1%, which is $50. So if you're making $55,000 a year, instead of paying $1,400 a year for healthcare, you'll pay $50 a year for healthcare. That's the difference we're talking about. That's the difference we're talking about. And if you make $200,000 a year, right now, if you make $200,000 a year, you're spending what, $5,000-$6,000 a year for healthcare. So instead, you would pay 1% of your payroll, which is $2,000 a year. Still a huge bargain, especially for the employer and for the employee. Whether you're making $200,000 a year or $50,000 a year, it's a huge cost savings. The other thing we have is the income tax. It doesn't kick in until $150,000 and up at 0.5%, and it goes up and up and up the more you make, so that those that are making millions a year will pay 2.5% of tax. Those making over 150,000 a year will only pay an extra 0.5% of tax on what they make over 150,000. If you make under 150,000 a year, your income tax won't go up at all. The last thing is a gross receipts tax, which is a 2.3% gross receipts tax. And so the options were a sales tax, gross receipts tax. Sales tax is very regressive. It hurts poor people. Instead, we did a gross receipts tax, which is much more easily spread out throughout the economy on a macro level. And so that 2.3% will be absorbed into the economy. That, I mean, at the end of the day, people will say, well, we end up all paying for it. Well, yeah, in essence, that's true, but that's much more absorbable over 40 million people if you have a gross receipts tax that can then be spread out, especially because with the cost savings that people have, they can now spend more into the economy. And now, those companies that are going to have the gross receipts tax will be making more money because more people are buying their products. So that's kind of the macroeconomics aspect of it.
Fantastic. I mean, it makes complete sense. and I thank you for breaking it down for everyone too, because I can see in the comments that, everyone it's revolutionary, and it really does feel like it is. Can you break down the legislative timeline of this and the urgency?
Yeah. We're in an urgency. We're in an urgent moment right now. And so, first of all, there's two things going on. I introduced AB 1400. I also introduced ACA, which has nothing to do with Obamacare. It's not Affordable Care Act. So we just call it a constitutional amendment, Assembly constitutional amendment. ACA 11, which deals with the constitutional issues and the taxation. They're separated. Right now, the policy bill, AB 1400, is going through the legislature. It made it through Health Committee. And tomorrow morning, it's an Assembly appropriations. If it gets through appropriations, this is what you all need to know. We only have 10 days to get it through the Assembly. It has to get through January because this is a 2-year bill. And so,
10 days.
So that's, if it gets through the appropriations tomorrow, then we have to get through the Assembly in 10 days. And we only have 2 or 3 session days to make it happen. So we need everyone to contact their Assembly members, let them know how much. And then if it makes it through the Assembly, then we have several months to get it through the Senate. Then we have time to continue to work on it, accept amendments, work with my colleagues and all that. And at the same time, work on ACA 11, which is the taxation mechanism I just discussed, and work through that as well.
Awesome. And just to plug that, if you guys go to the link in my bio, you can access phone banking calls for today in an hour and a half, and also the phone numbers of all the assembly members in the appropriations committee that you should be calling right now to make sure that this passes tomorrow morning. So that's just a side note, everyone. If you want to get involved and you want to see this pass, call these people, and you can find that at the link in my bio. So what can people, who are the groups that are fighting against CalCare, and who are we up against in this battle?
Well, it's the insurance companies, it's the corporations, it's the healthcare, like hospital associations, hospitals, companies, as well as the doctors right now are opposed. So these, even though if you poll doctors individually, they support single payer, the California Medical Association is opposed, and we're getting a lot of the Chamber of Commerce and businesses opposed as well. And so, we anticipated that. We do know the taxation, and someone's talking about the groceries tax. I just want to let them know we just introduced ACA 11, and the reason, and it does not have the time constraint of getting through this month, and so we have time to work through that. If something other than a groceries tax is suggested that could bring in the right amount of enough money, we can discuss that. We can discuss exemptions. Right now, currently in the bill, there's an exemption for the first $2 million on the gross receipts tax. I do believe that this will be such a boon to the economy that there'll be a lot more money coming into businesses. But absolutely, I think we need to talk more about the taxation scheme and whether it works or not. And by putting something, I'm the first, single payer bills have been introduced over the last 20 years. I'm the first one that actually put forward a funding mechanism. And so that allows the debate to occur. And so for those that have concerns, I want to hear your concerns and the debate and the conversation as well.
Yeah, we just need to let it pass the assembly first.
The policy bill, and so, I want to talk about that, why it's separated. The policy bill can move forward while the funding mechanism we can take our time with that. And the key behind that is that the policy bill is required for us to apply for federal waivers. At the end of the day, the taxation bill will go before the voters. So the voters are ultimately going to decide. And so I think that ultimately, the voters will decide, do they want to keep on paying more than anyone else in the world for healthcare? And let me tell you this, the number one reason for family bankruptcies in our country, including in our state, is medical bills, number one. And so that is the case even after Obamacare went into effect. Even with the Affordable Care Act, it's still the number one reason why families declare bankruptcy is medical bills. And that's because just because you have insurance doesn't mean you actually have real access to healthcare. People ration their care, they ration their medication. Let me give you an example. 30% of people on Covered California, which is our Affordable Care Act exchange, 30% have what's called the bronze plan. And what that means is, there's bronze, silver, gold. The gold plan, low deductibles, you get a lot more covered. Bronze plan means you don't get as much covered and your deductible is really high. For those that don't know what a deductible it is, it's basically how much you have to pay out of your pocket before insurance kicks in during the course of a year. So in the bronze plan of Covered California, which 30% of Covered California folks have, you have to pay out of pocket $8,200 before insurance kicks in. And for families, you have to pay $16,000 before it kicks in. And that's in addition to paying monthly fees as well. So you have to pay $16,000 out of pocket before insurance kicks in. So now you know why those families that are choosing the bronze plan because they can't afford the nicer one, are already lower income, already struggling, now are rationing their care because of they can't afford to pay $16,000 out of pocket.
Yeah, I mean, and speaking on that, systemic racism, wealth inequality, which we were talking about, is definitely a reality in California and prevalent in the healthcare system. How will CalCare address those health disparities and inequities?
Yeah. In thinking about Dr. King's birthday, Dr. King did say the greatest of all the inequities, of all the injustices, inequity in healthcare is the most inhumane and immoral. And it's true. And so this fight has been going on for a very long time. our economic system is saturated, with racism and racist outcomes. Our healthcare system, absolutely. There's a reason why you see differences in Black life expectancy, Latino life expectancy. For Black women, their birth mortality giving birth, the percentage that die giving birth. In fact, here's a really, thinking about COVID, the number one determinant as to whether someone died from COVID is their gaps in health coverage. And it's sad. And so the first year, so if you think about from June 2019 to June 2020, which only covers the first few months of COVID, Black life expectancy went down 2.7 years. Latino life expectancy went down 1.9 years. And some folks might say, well, yeah, that's because they had pre-existing conditions that led them to be more vulnerable to COVID. Well, ask that next question. Why do they have pre-existing conditions? Why is diabetes so prevalent? Why are these illnesses so prevalent? And a big part of it is they don't have access to healthcare, real preventative care. And, we can change that with CalCare.
Absolutely. And speaking on, what about issues that, don't maybe like directly involve healthcare, like homelessness? How will healthcare help combat those type of issues?
Well, we spend an enormous amount of money on 911 calls for medical emergencies for our unhoused brothers and sisters. And if you talk to the unhoused community, you will find many of them ended up unhoused because of medical bills. Maybe they lost their job and got sick, or they got sick and then lost their job, which means that they lost their insurance. Then they couldn't pay for their rent because they had to pay for medical treatment, or they couldn't pay for their medical treatment and they lost their job. It's all connected, and mental health is included in CalCare as well. And so, the reality is that a lot of, we are seeing, because I used to be the chair of the Aging and Long-Term Care Committee, over the last 10 years, we're seeing first-time homeless who are seniors more than ever before. Our elderly are becoming homeless. And they have, even those that have access to healthcare, they don't have, again, true, meaningful, full, comprehensive coverage. And so, for example, my father has Medicare Advantage. So he still goes to the same doctor, he has coverage. He pays a whole bunch of money out of pocket. He doesn't get dental care. And so he ended up in the hospital once because he waited too long for a tooth and had to get his teeth extracted and had an infection and ended up in the hospital for 3 weeks. Now he could afford it. It still was a lot of money. It wasn't easy, but he could afford it. Think about those that can't, and they end up on the streets or end up dying because they don't go to the hospital because of a toothache that ends up as an infection, that ends up in their bloodstream and they die. That's happening in the wealthiest state and the wealthiest nation on earth. We have insurance companies denying coverage, even when the doctor recommends it. And they will tell, the patient, and the doctor will tell the patient, start a GoFundMe account. Think about how immoral and how ridiculous that is in our current society that's so wealthy.
Absolutely. Oh, thank you. And I'm getting a couple comments that are asking about specifically mental health care and how that will be covered, and maybe the quality of care as a whole. Could you speak on that?
Yeah, it does cover mental health. It covers rehab, and it, in terms of quality care, let me mention this. So right now, folks are on Medi-Cal. I'm glad they're on it. It gives them at least a floor of coverage. But a lot of doctors don't take Medi-Cal because their reimbursement rate for Medi-Cal is too low. This would get rid of Medi-Cal and instead put everybody on CalCare. Get rid of Covered California, put everyone on CalCare, where you have comprehensive care. With the cost savings we get, we can make sure we have comprehensive care, and that the money, instead of going to insurance companies and drug companies, that it goes to care. It goes to your doctors and nurses. So your pediatrician, your family practitioner, your OBGYN will actually be well compensated and want to practice in California, including in underserved and rural communities.
Amazing. It's amazing. And I have been seeing a few times, this is going to end up in the Supreme Court. I have a couple of questions. Like, have we considered whether states can finance a public healthcare system?
Well, yeah, and we shouldn't be afraid of lawsuits. We know the lawsuits are going to happen. Look, we wouldn't have fought in California. We fought for marriage equality. That ended up in the Supreme Court. Does that mean we shouldn't fight for it because we're afraid of a fight? No, we should fight for what we believe in. We should fight for healthcare as a human right. And I went to Washington D.C. I met with some Congress members, Senator Padilla, Congresswoman Porter, Congressman Ro Khanna, and others, Nancy Pelosi's staff. But the most significant meeting I had, not that they're not significant, was with the Health and Human Services Department, the Deputy Secretary under Secretary Becerra. And we learned about the waiver process. There is a Medicare waiver process to allow us to ask the federal government to allow us to move federal money into CalCare. And so that's part of the process we're going through. You start with a policy bill that allows us to apply for a Medicare waiver. So we're doing it step by step. I'm trying to do it the best way possible. And you know, one of the Republicans during the healthcare committee, he said, "You're going to take, the same thing, the scare tactics, all scare tactics. Mm-hmm. Oh, you're going to take my parents' Medicare away." Mm-hmm. Well, what he may not realize, and I do because of my study of this and simply just talking to people that I know that are on Medicare, is that Medicare itself doesn't cover everything. And you have a lot of out-of-pocket costs. And you have to get Medicare Advantage, which is a private insurance to supplement your Medicare. We are on the road of privatizing Medicare little by little by little. CalCare is more comprehensive than Medicare, and it includes long-term care, and it has dental and vision, which Medicare does not have, and hearing. And so, I mean, think about the elderly. My dad has hearing issues, vision issues, and dental issues, and he's got to pay for it himself. And that's unconscionable. Again, he has resources to do it. I think about those working class families in my community that don't, and they just go and suffer, and they lose their hearing, they lose their eyesight, they lose their teeth, and they suffer.
So to clarify, CalCare is going to cover primary and preventative care, long-term care, dental, vision, mental health, and drug abuse treatment. It's comprehensive. It really feels it's fantastic.
And comprehensive reproductive care. We make that very clear in the bill.
Wow. Yeah. Another concern that some people have with public system would be longer wait times. I've seen that a few times in my comment section at this point. How would CalCare insurance payment patients have timely access to care?
That's a fair question. And what I would start by saying is the millions that don't have health care now or are underinsured have very long wait times. They never get to see anyone and never get medical help. And I think that let's start by understanding that we're all in this together. And that if we have our brothers and sisters in our community that aren't getting health care, that should matter to us. Even if I have great health care. The state provides excellent health care. But it matters to me if others don't have it. And that's the first point. But it's still a fair question because someone that has good health care is like, wait a second, I don't want to lose that. I don't want to wait. Right now, think about it right now on how hard it is to get things from your insurance company. They can approve if you go out of network, how long it takes to be seen by a doctor if your insurance company gives you permission. And so when people say Canada, this, that, and the other have wait times, look, our economy is we put about 50% more into our healthcare system than Canada does already. Our economy is already we're the 5th largest economy in the world. We have more providers, we have more hospitals, we have more clinics, and so the reality is that the same doctors and nurses and clinics that are providing care now will provide it under CalCare, except they won't have to be on the phone with insurance companies all day. So now they have more time for patient care and more time to see more patients.
Yeah, exactly. And speaking on, California is the 5th largest economy in the world. California, has a $2 trillion GDP or more, I believe. So how will this show that this is scalable? What does California implementing single payer healthcare mean for more than just California?
Well, the reality is we know that single payer healthcare is not going to happen in DC. I mean, they can barely get a jobs bill passed. They can't. They'll talk about expanding dental and vision for Medicare, and then it just falls apart. So the reality is with the current politics of DC, and I don't see it changing anytime soon. It's not going to happen in DC. It's going to happen with the states. Oftentimes, big things start in the states. New York has a bill. We have a bill. Washington State's looking at a bill. We have to lead the nation. And when we get it, and we show it's efficient, and we show people are getting great quality care, then it helps to bolster the federal government in moving that direction. It helps other states to move as well. The more states that get it, the stronger the argument is for a national program. But yeah, I think that California is in a prime position, given the size of our economy, our bargaining power. I mean, look, our economy is bigger than almost every country in the world. Our state population is more than almost every country in the world as well. We're not like, if we were a country, we wouldn't be a small country. We would be a big country. We would be one of the most influential countries in the world. We're already more influential than most countries in the world, based upon the things that we accomplish here and the things that we get done on the environment. We banned cosmetic testing on animals. The rest of the world, had to follow. I had a bill that banned the little hotel shampoo conditioner bottles in hotels. That's going to be going into effect over the next year or two. Already, wow. You see hotel chains starting to adopt that policy because California did it. We set emission standards for vehicles. The rest of the industry has to, we sell so many cars here, they have to start moving. And it moves the national dialogue and the international dialogue. We don't need to wait for anybody. We can set the agenda for the world. Or certainly for the country. The rest of the world is ahead of us in many ways, but we can set up.
Yeah. No, and honestly, I think this is a moment to give people a lot of hope too, because we're all watching the news and seeing Build Back Better get watered down, and it not even pass when it gets watered down, and change does not seem to be happening on the national level. And I, as a creator, see a lot of the time people just get so discouraged that nothing's going to happen, and then here you are with a fantastic bill that would actually fundamentally change people's lives. So that's fantastic.
I hope so. And I have to take off in a minute, but I'm happy to come back in, especially if it gets through appropriations tomorrow.
Absolutely.
To come back in the next few days and have another conversation.
Oh, I would love that. And thank you so much.
And answer more questions. So there's a lot of really good questions.
There are and people are, expressing, their struggles with the California healthcare system, and I really appreciate that. Everyone, this was Assemblymember Ash Kalra. He is fantastic. He authored this amazing bill, and I will be sharing after he leaves some resources that you can use to help pass this, and go over and debrief the timeline of things and everything like that. So again,
and also follow me on TikTok, because I've been holding off on doing lives until I get 10,000 followers. I think I'm like at 9,500 now. So you guys hit me 10,000. I'll do some of my own lives as well.
Awesome. Yes, everyone follow him on TikTok. We're going to be doing more of this in the future. And thank you for everything that you do. And thank you for joining and sharing this with everyone. Have a good one.
Thanks, everybody. Bye.